Keeping Kids Healthy is sponsored by Nicklaus Children's Hospital.
Hello, I'm Beatrice Canals here at Nicklaus Children's Hospital talking to the experts about kids and orthopedic care. I'm here with Dr. Kevin Horowitz, a pediatric orthopedic surgeon at Nicklaus Children's Hospital, and today we're discussing developmental hip dysplasia. Thank you for joining us, doctor.
Thank you for having me.
What is this condition and just how common is it in children?
Developmental dysplasia of the hip is a spectrum of disorders in which the hip is either not properly seated in its socket or the socket itself is not shaped normally. It occurs the milder forms occur in approximately 5% of children, and the more severe forms occur in less than 1% of children.
And what are the symptoms and signs that parents should look out for?
There typically aren't any symptoms because it is initially not a painful condition and it doesn't prevent or delay walking. There are clinical signs that can be best determined by a child's pediatrician or an orthopedic surgeon, and the diagnosis is confirmed with either an ultrasound or x-rays.
Now, if there's no real symptom, what can parents look out for? What should be of concern to them?
Well, there are certain risk factors that make you more likely to have hip dysplasia. The two largest ones are being born in a breech or feet first position, and the second one is having a strong family history. So if either of those are the case, then we are more aggressive in evaluating the patient.
Sure. And if a child is found to have this condition, should parents worry that they may experience pain or early arthritis?
So pain in childhood is not common, but pain in late adolescence or early adulthood is common. We think that approximately 10 to 20% of people that eventually require hip replacements have underlying hip dysplasia.
So perhaps it was never diagnosed?
That's possible.
Wow. And assuming they do have the condition and they show up at Nicklaus Children's Hospital for help, what kind of treatment do you offer?
So there's a range of treatment options that we have at Nicklaus Children's Hospital. These include bracing, casts, and surgery, and the treatment for each child depends on the age of the child and the severity of their hip problem.
So the most important thing is early detection.
Early detection is the most common, and there's clear evidence that the earlier it's diagnosed, the better the outcomes are.
That's great. Thank you so much, doctor.
Thank you for having me.
To learn more about the Orthopedic Surgery Program at Nicklaus Children's Hospital, call 305-662-8366 or email orthokids@mch.com.
Keeping Kids Healthy is sponsored by Nicklaus Children's Hospital.